So I have 15 minutes, I think, and I want to try and inspire any of you who are interested in babies or pregnancy or the birth world. I graduated in 1985 from Sutherland Chan in Toronto and started teaching 3 years after graduation and had a general practice in Toronto. And in 1995, I took a workshop that changed my career, which was a workshop in baby massage. And at that point in time, I already had 7 nephews and nieces who I didn't massage because I really didn't know anything about massaging children. And I had a good friend who had a baby on the way, and I was going to become his godmother and become his second mother because he was of African heritage. And the communities there are broader around mummy's, grandma's family, I think, than some of our communities in North America. And so I took the 4-day infant massage course and met the person who sponsored it. And she was an eat, breathe, sleep pregnancy massage therapist and wanted me to do the final take-home exam with her. I've been in practice for 40 years next year, which is crazy. Yes. Anybody got a gold watch for me? Please. Anyways, where was I? I lost it on the gold watch. She was saying that she wanted to do more education in Canada about pregnancy massage and birthing stuff. So somehow we got together and decided to form a company to up the educational and clinical skills of massage therapists within Canada. And most of our trainings we had to do in the US. And most of our training, she was pregnant because she saw a midwife speak when she was at massage school and ran home and told her husband she wanted a baby. She hadn't graduated yet, and she wanted to become a midwife. She didn't care if she became a massage therapist anymore. And he was like, you are finishing your school. You are not having a baby right away. You are graduating, and then we'll talk. So they had 3 children in close succession. So she was always pregnant when we were in the US, and she would be lolling about on the hotel bed pregnant, and I'd be studying like a fiend because I didn't have kids and I didn't know what I was doing. And so eventually Trimesters was formed, and to date we have done 4 trainings perinatally, and it is the best career on the planet. And massage therapy is the best career on the planet, frankly. But what I love so much, because I get distracted somewhat easily and I get bored easily, is that you can take your practice wherever you want. And mine just happened to go into the perinatal realm. So I know that there are some of you in the audience right now who have been at births, who have a perinatal practice. I have met my twin sister from Alberta and New Zealand, Marina, here today, Marina Locke, who teaches in Alberta. She should be up here with me, but we didn't pull out that, so we'll not do it this time, Marina. But we've been talking, and one of the things I love about these conferences with CMC, I have met the most extraordinary people. I have met my social media designer who's an RMT, who was my new best friend from Halifax last year. And now I've met Marina, and I hope that what you get out of these days is connections to people who fill your soul, because it's a crazy thing. And so for those of you sitting listening to me right now, I really would like the hair on the back of your neck to stand up at some point within the next 15 minutes, but no pressure, because I really hope that you can get and I know some of you already do, that's why you're sitting here, get the power and the privilege of working with families who are bringing children into the world at a time in our history which is not real easy for being a parent. And having worked in a hospital setting with students for 25 years with the highest risk pregnant clients and the highest risk birthing clients, the work that we do is so stunning around providing healing and some kind of joy within such stressful times. So we do not cause harm to our clients. We serve to make them feel loved and supported and listened to and massaged and more confident in their bodies and all the things that can not happen sometimes if you're pregnant or if you're high risk or if you've had a C-section when you wanted a home birth with a vaginal delivery. And I love my work because I get to say vagina a lot. So, and I get to point down there. So just had to get that out. You getting this, Mark? Okay. I knew he would. So tomorrow I'm going to do a 2-hour speak on 5 things that you should do in terms of your practice to be effective with pregnant clients. And having done the perinatal stuff for close to 30 years now, I keep thinking, you know what? The schools are teaching well. People know about pregnancy. They know how to provide good pregnancy massage. But I had an RMT a couple of years ago who was my demo person, and she said she had had massages while she was pregnant with 7 different massage therapists, and it was only the last one that she got that she felt she actually got an adequate and better than adequate massage. And it seems to me that in 30 years of doing this work, we should all be pretty competent working with pregnant clients. So if you're sitting in this audience because you have a special joy about working with people who are going to be bringing a baby into the world, you are so needed. And I just really encourage you to train with the best, to love your work, to translate to your clients that they can be powerful in their bodies when they're pregnant. They may not like being pregnant, but they can still be powerful in their bodies. 30 years ago, clients would come dragging their leg like Quasimodo into the clinic of myself and Allison, and they would be told by their obstetrician, yeah, you've got shooting, stabbing pain in your bum that feels like you're dying, but have your baby and it'll go away. And of course, that could be at 5 months, that could be at 20 weeks pregnant, and they have another 20 weeks to go, and they're supposed to just live with that. And they started coming our way, and then they would, I swear what they did was run back to their OBs, grab them by the collar and go, you have to refer to Cindy and Allison because I don't have any bum pain anymore. And I'm talking very casually here because I do think it's really important that we acknowledge the parts of the body for pregnant women aren't necessarily the same problems that a non-pregnant person has. So I'm sure that many of you know that your practice will be driven by the word of mouth of the pregnant clients and the birthing clients and the postpartum clients you see. One of the things I notice in 30 years of practicing is that fear in pregnancy has never been higher than it is these days. And we have the most brilliant medical technology that saves lives for women, if you're in North America anyways. And we have the most fantastic midwifery training and the capacity to have our babies at home if we so choose. And yet women coming in for pregnancy massage, I honestly don't think they've ever been so stressed or had so much anxiety as they have these days. And years ago, there was a couple of studies from the March of Dimes from the US who does a lot of work on the incidence of preterm births. And their goal was actually to reduce preterm deliveries in the United States. And they wrote two papers, and one was called Stress and Prematurity, and the other was called Stress and Pregnancy. And they were beautiful evidence-based papers that basically said that if a person is pregnant and is stressed, they have a higher incidence of preterm deliveries. And so that was like my one piece of solid evidence when we were trying to get started on our level 3 high-risk pregnancy program for students. And it actually worked because the OBs and the nurses knew how stressed pregnant people are when they're stuck on bed rest. So again, whether you work with healthy, normal pregnant people, whether you work with more high-risk bed rest or hospitalized pregnant people, whether you want to get into that labor and delivery room and roll your sleeves up and start helping with birthing deliveries. And honestly, when you do that, your lives will be changed forever. Your clients will never forget you. I attended a birth of an RMT who'd had 3 home births, and she had 3 different doulas. I won the lottery on the last birth, and I went to their home. It was the woman who was pregnant and her husband. They had 2 little kids. I'm going to say 6 and 4 were their ages. They had a midwife, a primary midwife, and a secondary midwife. This was in Toronto. Her mom was there, who was in her early 80s, and she had been a midwife and a nurse in the war in Britain. She had her 2 sisters. The one sister was an incredible photographer. The other sister's job was to keep the $29.95 pool from Canadian Tire warm, and they were using buckets. They didn't have any fancy birth pool at that point. They were going for basics because the mama wanted to have some of her birthing time in water. And that was our team. And when she was standing up with her husband behind her to push, and the kids came in, I'm not sure if they were there at the actual, as the baby came out, but they were there within seconds afterwards. And afterwards, when we talked, they said to me, that was the perfect birth. And it has been the perfect birth in my experience too, although there are so many of them are so amazing. But to watch a family get exactly what they want and need in their birthing experience is something that's absolutely phenomenal to behold. And really, that they laid in bed in sideline position for much of the night. And I was at her back with my fist doing counter pressure and working her low back. I was like sort of sitting on the floor and doing this. At one point, they had a picture of me with my head on the bed doing this while they were sleeping. It was the middle of the night. They loved that picture. The midwife was nowhere to be had. But at one point when she said, I think my waters broke, there was a head that popped up from the side of the bed. And it happened to be the midwife lying on the floor, who, as soon as she heard the membranes had ruptured, went into action. And when you are in that kind of milieu where you see how home-based and beautiful, and that husband and wife, he just smiled through the whole birth and looked into her eyes and had a cloth with his hand on her forehead. And it was such an epitome of support and love in that room. I was just the gal in the back doing the knuckle rubbing because they knew exactly what to do and they knew how to do it. And when I went to that family for a postpartum visit, the 2 kids who I'd only met at the birth, I was sitting on the couch because I wanted to see the birthing pictures. I knew they would be phenomenal. And the 2 kids, the 6 and the 3 or 4-year-old, however, came over and sat. The boy came, then the girl came. They came with their photo albums, sat down beside me, and wanted to show me their birthing pictures. of their birth, even though I'd only met them once at the birth, before I got to see the pictures of Oliver, the baby that I'd been in the presence of. And those were two kids that were completely attuned to how special and how beautiful and how normal birth can be. And those kids are, I think one of them's in university. The other two are, I think, in high school now. I still am connected to the parents, but they live overseas. When you get to be at a situation like that, it completely changes your neurons about what is possible to be in the birthing world. And the other thing, and Mark, you're going to have to cut me off because when I get rolling, it could be 3 days. Postpartum care for moms. Whenever my students went in the hospital, the students who wanted to work with the postpartum moms were twofold. They were people who wanted to see the babies, because the babies were in the room, or they had delivered babies themselves and they knew how much the new mother deserved and needed to be massaged. So I'd always laugh because the students who had 3 babies, they were like, let me work with the postpartum mom because I love them and I want to help them the way I needed help, or God help, whatever. And so again, the incidence of postpartum, not just depression, but the whole spectrum to psychosis and neurosis and OCD related to perinatal realities. We know, again, from the evidence-based, that the studies show that massage helps to reduce anxiety and depression and stress. And so maybe that's where you want to focus your work. And we've been talking today, in my world, we talk a lot about the pelvic floor, and we talk a lot about the breasts. And there is so much need for mid-thoracic work for the postpartum mom, for back work, for even pregnant women have breast pain. And most pregnant women who come for massage therapy, no one ever asks them, how are your breasts doing? Do they feel sore? Do they feel tender? Do you have breast pain? And I can tell you again, if you offer breast massage to pregnant people, their breast pain will be relieved, maybe disappear completely. They will feel so much better. So there's just such a wealth of arenas that we can work in. And I do think it's important to have good equipment. Look at this beautiful table. If you can get yourself an electronic table, these would be beautiful. One that reclines for your pregnant clients, even better. I'll teach you some ways to use stuff if you don't have it. But if you're at any stage in your career that you think you're going to be working in this field for some length of time, buy a hydraulic table. You won't regret it. It's the best thing possible for your body. So proper equipment, having confidence. The vast majority of people who take our pregnancy courses say they don't feel confident. And some of these are RMTs who've been doing pregnancy massage for a long time. I was saying earlier today, many people who say, yes, I'm perinatally focused and I do a lot of pregnancy massage, have never touched the belly of a pregnant person. And I don't know how you do that. I do know somebody said, I'm not sure my friend would want her belly massaged because she feels like so many people interfere and touch her and, want to stroke her or whatever without her permission. And the things we do with pregnant women can be quite atrocious. From you're carrying small, you're carrying large, you're as big as a house, you must be having twins, are you sure you're okay? There's somebody, are you a nurse as well as a massage? Okay, but you've been around because you just keep nodding and And it's so, so true, right? On the subways in Toronto, imagine how busy it is at 5 or 6 o'clock, sardine hood on the Toronto subway, and people want to touch your pregnant belly. That shouldn't be allowed. In Jamaica, they say, baby mama, I'll get up out of my chair and you get my chair on the bus. And if they don't, somebody will come along and say, give that baby mama a chair. So the difference is in respect, depending on the cultures, right? So I don't presume that all of my pregnant people want their tummies rubbed, but if they do, and sometimes they're not sure, you're touching that human being and it's their first baby massage, professional baby massage, because mommy's always rubbing. Am I done? 1 minute? Okay. So anybody have any hair standing up on the back of their head at all? I don't know what to say to make that happen, but I want it to happen for you. The last thing I'm going to say, she said I had a minute. This is kind of not okay. But when I left Toronto, I've been out of Toronto for 18 years. And the first time I taught baby massage, a mom was in that room with her baby learning baby massage. And she contacted me 3 years later and said, I was in your first baby massage class because you said it was your first, and I want you to come to my birth. And I went to her birth, and then I went to the third birth, and both of the births ended up as a C-section. And then I moved out of Toronto for the last 18 years, and she just contacted me and said, we're going to a spa outside of where you live. Can we meet you? The first daughter's 26 years old. The other daughter's 17. And Lily, who's on all our posters still as a baby, just finished her first year of university. And the girls love you and they want to meet up with you. So we, the four of us, are meeting at St. Anne's Spa and having a day spa together. I'm paying my way, they're paying theirs, and I get to meet their daughters who are now getting close to childbirth age. So that's what happens if you choose to work in the perinatal realm.